Managing patients with the background of cardiovascular disease is complex, and an extensive experience with in-depth investigation is required in order to have a proper diagnosis.
We have a 43-year-old lady from Yaoundé presenting to the hospital with breathlessness, fatigue, and tiredness on minimal exertion. On top of that, she's been troubled by episodes of atypical chest pain, and she's been evaluated on the basis that her symptoms are secondary to gastritis. In Cameroon, they break it down to gastric.
The case of this patient, who has come far away to seek for proper diagnosis and eventual treatment, is telling of the complication involved.
I have palpitation. The whole day my heart is palpitating. He wrote a medicine to stop that palpitation. It stopped. The pain was still there. So I had the cardiologist at the General Hospital in Yaoundé told me to go and see a gastric expert, a doctor to a gastric expert. A friend who saw me struggling to cure myself sent me a message in the phone that there is hope in the horizon, that there is a center in Buea, a heart center.
So how do you feel now?
I'm feeling better.
Right. Ladies and gentlemen, this is a typical case of a patient presenting with classical cardiac symptoms. She has no background history of hypertension, no diabetes, no dyslipidemia, no history of sudden death in the family, no cigarette smoking, no risk factors in essence. Okay? So now, how do you establish a cardiac diagnosis in these types of patients? You go beyond, do the blood tests, make sure that there are no inflammatory markers to exclude pneumonia, make sure you do your D-dimers to exclude issues like pulmonary embolism, and of course she's been evaluated by the gastroenterologist with no beneficial effects. We went on to do her echocardiogram, which revealed moderate left ventricular systolic dysfunction. Therefore, she presented with heart failure. Now, what are the possible causes of heart failure? We've excluded ischemic heart disease, given that she's not got any particular risk factors. Also, the pain was atypical. After having done lots and lots of coronary angiograms, it is very unlikely that this lady has ischemic heart disease.
This center is up to the task, and there are signs of great improvement.
I spoke to the junior doctors around. They are not familiar with this condition, and I suspect we have lots of these conditions around that we fail to diagnose, and we attribute them to gastric, which in effect, this lady's case is myocarditis. So we are actually treating her for heart failure, and of course, she has made significant progress, and will continue to monitor her, and I suspect with time, with the heart failure treatment, her left ventricular systolic function will improve.
In order to fully manage its patients in all cardiovascular conditions, this cardiac home has just introduced new entries capable of handling not only non-invasive diagnostics of adult ultrasound studies, but equally pediatric ultrasound studies, making the center a reference.
We decided to buy an ultrasound, modern one, and we then hired a specialist in ultrasound studies. So we now have a Siemens brilliant machine which does an extensive range of ultrasound studies, including thyroid ultrasound studies, carotid Doppler studies, breast ultrasound studies, abdominal ultrasound studies. This ultrasound machine is beneficial in the sense that patients will conduct the necessary and relevant investigations on the spot. We don't have to send them to other centers, and most of the time when that happens, they are lost to follow up. We've optimized our ultrasound machines with this Vivid7. This is a fantastic and reliable machine. I think we are the only one in Cameroon with this modern machine. It does not only adult cardiac ultrasound studies, we also have pediatric ultrasound studies.
These therefore inspire hope and good news for cardiac patients who may not necessarily be flown out of the country for treatment.